Welcome to Black Women's Health. I'm Dr. Rahman. Today I will be discussing with Dr. Prabhakar the growing global incidence of uterine fibroid tumors and what we need to know.
Yes, thank you so much for having me. So I am a board certified OBGYN, and after I did my training, I did an extra 2 years of fellowship in minimally invasive surgery, where I learned some advanced laparoscopic and robotic techniques that were just coming out. So I trained in the East Coast in New York, where I had a very kind of a variety of patients that I saw from all over the world. So it was a really fun place to train. And then I moved all the way across the country to the San Francisco Bay Area, where I started practicing in Oakland, and I saw again a lot of very diverse patients. And the theme that seemed to run through both of these places was that I saw many women with fibroids, and I really started getting more passionate into, I became more passionate about this topic. Why do some women get fibroids and others don't? Why do they grow in some women and not in others? And I just remember all these stories from my training and my early years of practice about how devastating fibroids were in the lives of so many women. So it was always something kind of near and dear to my heart. And my own mother had fibroids, and I saw her suffer with them. She ended up getting a hysterectomy with a big vertical incision. And this was when I was just a teenager. And, I didn't know anything about fibroids or gynecology at that time. But looking back, I can really see how difficult that was for her. So this topic has just been very close to my heart. And in New York, I trained in Brooklyn. So we did have a large African American population from there, and also recent immigrants who came from Africa, also a large South Asian population, whom it also affects disproportionately. But in Oakland, similarly, a Black, South Asian, as well as just Asian and white women, really, I've seen them across the board. But yes, I would say the predominant demographic has been African American and South Asian. For many women, it's a new diagnosis. So they've just been told that they have fibroids either because they were getting some scan for something else and they incidentally found fibroids and they were sent to a gynecologist, or they're going through fertility treatments. And so they're going through IVF. And in the process of doing all those scans, it came about that they have a fibroid and now need to deal with that prior to continuing with treatment. So that's usually how they enter my practice. And they want to know, like, well, is there something I need to do about it? Or is this just something I need to monitor? So for many, many women, this is the first time. I do have some who are coming for a second opinion because they have been told that they need surgery. And so many women are hesitant to do surgery as the first option, and they want to see, is there anything else that can be done? So I would say those are the two kind of groups of women. Instead of saying, well, come back, if it becomes a problem, I give them the option for monitoring it, because I do see some women who come in and say, well, just 3 years ago, they told me it was 2 centimeters and now it's 12. Like, I wish somebody had, gotten a scan in between, and maybe if it was 6, we could have done something different rather than now, me needing this type of surgery. And so I hear that. And so I tell women, yes, this is not routine or standard recommendations, but every couple years we can get a pelvic ultrasound now that we know you have fibroids and just see where it's going. Because, like you said, I mean, if it's really big, a lot of times people will have symptoms, but sometimes people have big fibroids and they don't know about it, which always fascinates me, because when I press on their belly, I'm like, there's this huge mass, and they're like, what? I just thought I was gaining weight. When somebody says, "Oh, I'm running to the bathroom a lot. I'm peeing every couple of hours, and this did not happen to me before," then I also suspect fibroids. Painful sex is another one. If you have fibroids lower in the uterine segment or near the cervix, that can cause painful sex. So I ask about those things. And then definitely fertility questions too, because we know that once you get pregnant, fibroids can have their own effects, but many times fibroids themselves don't make a great environment for conception. So if someone says, "Oh, I've been having recurrent miscarriages or more than even two," I'm like, "Okay, we really need to take a look in there." But I love your point about asking more direct and detailed questions, because I think for many women, they've also take as an example their moms or their cousins or their aunts from their they've lived together, and they're like, well, that person also had periods like this, so they've just sort of normalized it for them and their family, but yet it's actually not normal. So sometimes the fibroids can be on top of the uterus, they can be in the wall of the uterus, or they can actually be inside the cavity. And this last category of fibroids are the ones that truly can pose the biggest threat to pregnancy, because they're right in the same space that a baby would form. So when an embryo is made, either naturally or IVF, this embryo can then bounce off of that fibroid and not get implanted. So that category of patients, I definitely encourage to have that taken care of. And yet we see other patients who get pregnant, no problem. They didn't even know they had fibroids. So it's a mixed bag. And I think that's one of the things that's very difficult to comprehend about this topic, and is so frustrating for many, because there's no path to say, well, who's going to be in this bucket and who's going to be in that bucket. I actually support that recommendation of including an annual ultrasound with your exam. Maybe it's annual, maybe it's every 2 years, but in some sort of a cadence, because yes, there are a lot of things that are totally benign that we find that may create a little anxiety, but today's woman really wants to know and understand her body. They want to know what's happening, so they're not surprised 5 years later by this ovarian cyst that went from 2 to 10 centimeters, and now they need to actually get surgery when they could have at least prepared for it all along, or done something when it was sooner. All the women with fibroids that I see, are deficient in vitamin D. Yes, I have seen that.
So you check on a regular basis.
Well, now I do. Now that, like, this year I've really gotten into the lifestyle and dietary aspects. And so I've been checking. Yeah. Going forward, especially with precision medicine, it's going to be like, well, what is that microenvironment? How do we define that microenvironment, and how do we pick that up early, as you said, and how do we influence that at a much earlier stage? Yeah, so I think fibroids are an inflammatory, are being more studied to be an inflammatory condition as well, that is exacerbated by various by inflammation in the body, and could we eat a little bit better so that some of these fibroids may not grow or may even shrink? So there's some studies that show cruciferous vegetables help. A more plant-based diet is helpful. So these are things that I talk to my patients about, plant-based, less processed food. These are the things that, of course, are the cornerstone of all health, not just fibroid health, but specifically for these young women, honing those points in, I think, are helpful, because many people are not eating that way. We live in a fast culture where it's like takeout, and all of that is made easy today. So I think that's something I really emphasize, and that's something that's within a patient's control. So I think psychologically they like that. They're like, okay, there's some things I can do, so let me start there. And then reducing exposure to plastics as well. We did all this stuff about microplastics, and so moving to glass Tupperware and avoiding plastics in the dishwasher, those kinds of things too.
So I have to ask you, do your patients comply with this? And have you been able to document changes as a result of dietary changes?
I had my patients actually do comply, not everybody, but the people who are really motivated and want to avoid surgery do comply. That's a great point. I should actually start to document this, but I can think of two patients. One who had this 8 centimeter fibroid, and she was like, I just want to get pregnant, but I don't want surgery. And then she did 6 months of the lifestyle changes, and she came back and her fibroid was 4 centimeters. So
Really?
yep.
That's
So she
impressive.
It's super impressive. So she actually avoided surgery. And then I had another patient who had fibroids who said, okay, every time I get my period, I just feel so awful. So I said, okay, try these lifestyle changes. And she will say, like, as soon as I make those changes and eat clean, my pain and bleeding aren't as bad. But I know that if I go on vacation, whatever, I start eating pizza and all these things again, then I can see clearly the effect of it. So now this is not in everyone, and is everyone, adhering to the strict protocol? Probably not, but I think it's anecdotally, it's promising. I
True.
really would love to do my own study on some of these herbs like fenugreek. Being Indian, there's all these
Ye-
things, Indian herbs and spices and
Yes,
all the stuff that has shown to be promising, but we don't have any studies, and I really wish I could do one. For the lifestyle modifications, I mean, I really just start with the 6 pillars of lifestyle medicine, and I go through all of that, including diet, reducing alcohol, nicotine, sleeping well, to reduce inflammation and boost your immune system. So it's not always about taking something, but it's really, like you said, you have a lot in your own control. So how are we moving, eating, sleeping? And if we can do that well, that takes care of a lot. So that's where we start. And patients, even if their fibroids don't shrink, their symptoms get better. And for many, that's
good.
all they need. Sometimes being on hormone therapy can activate fibroids a little bit. It's not necessary for everyone, but again, this is a perfect time to monitor them. So getting an ultrasound every couple of years, if you do choose to be on hormone therapy, is helpful. As part of just doing taking care of so many women with fibroids, I'm surprised at how many have said to me that they've put together their own plan based on scrolling through social media and going on Reddit and Googling. And I thought, wow, there's got to be a better way to get information. So I wrote my book. It's called Fibroids Finally Heard. And I talk a lot about how so many women are dismissed with heavy bleeding. We talked about that in the beginning about many think that this is just the baseline, this is just normal. And other people are told, well, this is normal, or this is part of getting older, or this is part of perimenopause or whatever. So I address that, and then I talk, and then it's really a one-stop shop for anybody with fibroids. So what are they? What are the treatment options? What can you do? How do you navigate the healthcare system? Do you need surgery? If so, what do you have to ask before? How do you recover? And then I have some quizzes that people can take to really see, well, I'm bleeding heavily. Could I have fibroids? I have another quiz. Am I a surgical candidate? Am I a candidate for non-surgical treatment? And then I have a bunch of like just charts and tables that patients can use to keep track of symptoms and have all their data organized before going to the doctor, because we know that sometimes the visit is so quick, 15 minutes, and they need to get the most out of it.
That's very good. So what we will have to do is exchange books because I too have a workbook, but for some reason,
Yep.
not as much attention gets placed to fibroids. Do you have any thoughts why that would be?
I think we just need to be more loud about it. I think fibroids is I do feel like fibroids are like the stepchild, but we need to get there. We need to make it front and center. We need more people to open up. Lupita Nyong'o has been talking about it a lot now because
Yes.
she's been diagnosed with fibroids. But the more people open up and talk about it, I think the more we can gain traction. But absolutely, I mean, it affects 80% of women by the time they're 50. So this is a big deal.